This is the supine 90-90 hip internal rotation test. What you're going to do is we'll start on our left hip. We'll flex it to 90 degrees. We have our knee flexed at 90 degrees. I'm going to reach up and stabilize my knee here with my opposite hand, grab my lower leg and internally rotate my hip and eyeball that. Is that between 40 and 50 degrees? And of course, I'll do both sides, stabilize here, rotate here between 40 and 50. What I'm going to show you here will stretch out those tight fibers of your hip capsule, which will then realign the hip appropriately, restore normal arthrokinematics and range of motion. And if you're having pain, this can take your pain away as well. So I have a green monster band anchored around this pole here. I'm going to demonstrate on my right hip. So I'm going to step inside with my right foot. And I'm going to get the band up as high as it will go, so right into the bikini area. And I'm going to get out on my hands and knees so that there's a good amount of tension pulling on that band. So the band here is providing a lateral distraction. It's pulling the femoral head or the ball away from the socket, which is then stretching out the tight fibers of the hip capsule. So once I'm in this position here, what I'm going to do is simply oscillate back and forth at 1 to 2 oscillations per second for 30 seconds. So again, this is stretching out the tight fibers of the hip capsule, helping restore normal alignment and arthrokinematics in the hip joint, which will improve your range of motion, which will improve your performance. And if you're experiencing pain, this can help take your pain away as well. Now, I can progress this though. So once I've done 30 seconds of 1 to 2 oscillations per second, I'm going to maintain this lateral distraction, maintain my neutral alignment. So I'm not allowing the band to pull me towards the pole at all. And I'm going to drop my hips back towards my heels, again, maintaining neutral alignment. So now I'm combining an osteokinematic motion, this is hip flexion, with the arthrokinematic motion, which is the lateral distraction. So this is a progression. If you experience pain with this, what you can do is just stay within your pain-free range of motion. Just bump up against your pain and then come back to neutral. And eventually your range of motion will improve. So again, we do 30 seconds of 1 to 2 oscillations per second, and then 10 to 15 flexion extension cycles, staying within a pain-free range of motion.